Hi, I'm Lisa Quat. I am a principal research fellow, associate professor at the Department of Clinical Neuroscience at the Brighton and Sussex Medical School.
Hi, I'm Dr. Jessica Eccles. I'm an associate professor, a reader in brain body medicine at Brighton and Sussex Medical School. I'm also a consultant psychiatrist in a neurodevelopmental service. This paper is about the concept of something called rejection sensitivity. So people may have seen on the internet, in community and neurodivergent forums, this concept of RSD. And RSD is something that seems to resonate with a lot of people, but there is actually very little research. And even the research that there is actually not limited to ADHD. It's in post-traumatic stress, it's in self-esteem, and it's in ADHD. So what this was about was basically exploring what is the concept of rejection sensitivity. And this was done not with numbers, but by conducting interviews with people with lived experiences of rejection sensitivity.
We found that rejection sensitivity in people with ADHD, they describe it as overwhelming and long-lasting. And we found three themes in our data. So we found that people describe that rejection sensitivity often leads to withdrawal. So they avoid friends, they avoid family, work, or opportunities to prevent rejection. Second, we found that it can lead to masking or hiding your true feelings and pretending to be tough, not to be affected by the perceived or actual rejection. And that can cause people to lose touch with their real emotions. And then interestingly, third, we found that there are a lot of unpleasant physical sensations in rejection sensitivity, like nausea or chest tightness or even heat when rejection is perceived. And what all participants also said is that all of this can lead to loneliness, anxiety, depression, and missed opportunities in friendships, education, and careers.
This research is really important because although patients often are talking about rejection sensitivity, the scientific community and the medical community perhaps are not really sure what this is. So this is one of the first papers to actually describe the phenomenon. And the reason why the phenomenon is it's really important to get a sense of what it is because how impactful this can be on people's day-to-day emotional experiences. And we know, although it's not in the diagnostic criteria, that emotion regulation is such an important feature in neurodivergence. So hopefully this will bring the concept of RSD to both the public and to the medical community. Secondly, it really shows the embodied nature of all experiences, how brain and body are linked.
So this research shows that rejection sensitivity is a major challenge for people with ADHD and not just a minor inconvenience. And then in the future, we shouldn't treat it like a minor inconvenience because it affects mental health, it affects relationships, life chances. And understanding this can really help reduce stigma and hopefully improve support for ADHD people. So by recognizing that rejection sensitivity is a part of ADHD, professionals, researchers, clinicians can develop better strategies like therapy, specific therapy, and social support to help people cope better with it. And it also highlights the need for more empathy and understanding from others, which could really reduce the negative impact and improve, hopefully, quality of life.
To find out more about the exciting work going on at BSMS, please follow the link below. Thank you.